a very safe, very effective patient monitoring system. It's in place across Eastern Health and is working very well. We have one site, Health Sciences site, where the nurses have had more adaptability problems than we've seen elsewhere, and we are trying to work with them to resolve it. But I would reiterate and say clearly, patients are not at risk. We have in our ICU and our CCUs one-to-one nursing. Every patient has a nurse, and we tell all of our nurses, and in fact insist, that they use their eyes and their ears and their brains and their hands to look after people. We nurse patients, we don't nurse monitors. If the monitor is in fact telling you something that you don't believe, check your patient. If your patient's telling you something that the monitor's not, believe your patient. Monitors are a tool, they're not diagnostic, they're not treatment. Nurses need to remember that, and they need to remember that they're to use all of the tools at their disposal. The nurses are, in fact, resolving a number of the issues. A number of the complaints that were reported in their November report to us have been resolved. They are continuing to work with us to resolve some of their other concerns. We are trying to resolve them. And in fact, some of them are not issues at all. There was a report today in the Telegram about patient safety occurrences. I would like to tell you that those are not patient monitoring occurrences. Patients do have issues in our ICU at times, and their heart rates may drop. It's not because the monitor is not working. Appropriate treatment was applied to in all of those cases, and in fact nurses were at the bedside in all of those cases. Arterial blood gas lines were in place. There was concerns about patients bleeding into their beds. They did not. The occurrence reports are very specific, and the nurses involved who raised the issues told us exactly what happened. And in fact, they were at the bedside again when these issues were occurring. In one case, they put the bedside down. The lead that connects to the arterial blood gas part of the patient monitoring system, the lead broke. It broke at the connection. They were concerned that that was possibly something that was going to happen again. We looked at that issue with the nurses and resolved it by reconfiguring where those monitors and those leads are placed so that they're not going to be impacted by bedsides going down. That's what we expect of our nurses, to help us problem solve, and we congratulate them for that. The patient did not bleed into the bed at all in an unsafe fashion. They were at the bedside when that occurred, and they were able to control all issues with the patient. There was a case where a patient's heart rate dropped. The monitor did not alarm because it was under 3 seconds. The heart rate drop lasted for under 3 seconds before the nurse was at the bedside. Simultaneously, the patient's blood pressure dropped. Appropriate action was taken by our well-trained, well-qualified critical care nurses, and in fact the patient had no harm done. When we simulated that again, we found that if the heart rate or the blood pressure, either alone or together, happened to drop again and be sustained for longer than 3 seconds, in fact the alarms do go off. All of our cardiologists are totally satisfied with these monitoring systems. The critical care physicians have a concern about the noise from the alarms. We're working on trying to reduce and muffle some of that noise. It is a little different noise than what has been in the ICU at the Health Sciences before this. They are safe. The monitoring system is safe. We need to help our nurses adapt to the change. When this monitoring equipment was selected, it was a group of about 20 people consisting of nurses and physicians from across the province who went out on a nationwide search for the best monitoring equipment to meet our needs. They came back with this particular system in mind. They did an evaluation, and over 92% of the people involved agreed that this was a very good, in fact the best system for us. The people that didn't agree were the nurses from the Health Sciences Center, and they are now the ones having a problem. We need to help them. I'm not suggesting that we don't listen to them. Unhappy nurses make an unhappy workplace, and we need to see what we can do to make them happy, but it doesn't mean changing our patient monitoring system.